Welcome to the Public Health Nursing Child Health Clinic Skills Demonstration. This video will utilize scenarios to review key examination techniques and demonstrate skills needed to complete a child health clinic visit. Prior to the clinic, gather any equipment needed to complete the clinic. This may include the ASQ3 kit material, an eye paddle occluder, pen light, fixation stick, or a sticker placed at the end of a tongue depressor, brightly colored objects such as those located in the parent resource kits or the comfort kits. Complete a review of any completed screening tools and the chart to identify any areas of focus during the clinic visit. Developmental screening such as the ASQ3 provides a quick check of a child's development. It's a snapshot of a child's motor, cognitive, language, and social emotional skills. Through screening, we help determine if the child is meeting the appropriate milestones for their age. Review of completed ASQ3 questionnaires in the child health clinic provides the community health nurse an opportunity to highlight a child's strengths and identify any areas in which a child may need more help or practice. The community health nurse helps identify appropriate early intervention techniques for use at home, shares information regarding available community supports and services, provides follow-up and monitoring as needed, and offers referrals to other health professionals for further assessment as required. Let's introduce Jonathan. Mom, Anna, has brought Jonathan in for the 18-month child health clinic appointment. The community health nurse is beginning a discussion regarding developmental screening. Thank you for completing the developmental questionnaire. Did you have any problems or issues while you were completing it?
No, I was easily able to answer the questions today.
This is a quick screening tool that will determine if Jonathan's development is on schedule for his age. The results inform us of his strengths and identify any areas that may need a little help. The community health nurse reviews and scores the completed 18-month ASQ3 information questionnaire and transcribes the scores and answers to the overall questions summary sheet. The parent responses, graph bars, and any additional information are reviewed for discussion of Jonathan's strengths while noting any areas of concern. There are multiple areas of development captured in the ASQ3. Jonathan's developing as expected in the areas of gross motor and fine motor skills. I can see from our time in clinic together that there are no problems navigating the environment. Jonathan is an active toddler. I noted from the overall responses, you have also reported that your child does not talk like other toddlers of similar age. Tell me more about that.
I can understand most of what Jonathan says, but others have some difficulty. On play dates, I find the other mothers have to ask what he's saying. The other day, my mother was visiting and she couldn't understand what he was saying.
So it seems that those who live outside the home have difficulty understanding what Jonathan says, and this is becoming concerning to you. The results of the ASQ3 screening indicate that speech development should be monitored closely. I can help support you in this. Do you have any other questions?
No, what are some ways to help Jonathan?
There are many ways that you and your family can help support development. I have some age-appropriate learning activities that give some great suggestions on promoting language skills. There is also the HI website that has good information regarding speech, language, and opportunities to stimulate development. As well, in your parent resource kit provided today, there are some books that you can read together at home.
I'll certainly use this information. Thank you.
I noticed that you identified a concern with Jonathan's behavior. We also noticed this in the problem-solving and personal social areas of the questionnaire. You said temper tantrums were an issue. Can you tell me more about this?
Jonathan's temper tantrums can be difficult to handle. There's screaming, crying, and kicking, and so much. I've tried to figure out what triggers them. Sometimes it's tiredness, sometimes it's hunger. I just want this phase to be over.
Toddlers and tantrums can be difficult for any parent to handle. It's great that you're able to identify some of the triggers. Based on our conversation today and several areas of concern in the developmental screening, I would like to recommend some further assessment. There are a couple referrals that I think would be beneficial. I'd like to refer to child development. The referral will provide Jonathan a thorough assessment by several specialists, which will include speech and language. Once the referral is accepted, they will send you a form to complete that will give them more information to use in their assessment. Is this something that you think you would be interested in?
Yes, I think it would be a great idea. I'm becoming more and more concerned, and I really want to do what we can do.
I would also like to recommend the Intervention Services Direct Home Services program. This is a home-based program that will be individualized for Jonathan. A child management specialist will assess him and provide you with an increased understanding of Jonathan's abilities and strategies to address developmental and behavioral needs. Direct Home Services and Child Development will often collaborate to support the best outcome possible. Do you have any questions about this referral?
Do I need the intervention services if I accept the child development?
This program is offered in your home to assist you with developmental needs specific to Jonathan. Their service focuses on the whole family, not just the child. Parents and caregivers play an important role in a child's development, and as such, participation in home visits is vital to a child's success.
Thanks, I'll accept both referrals.
Wonderful. I will get these referrals completed and sent to the appropriate professionals. As well, I will advise your primary care provider about these referrals. They will be in touch with you once they have arranged an appointment. And if you have any further questions or concerns, please reach out to me.
Thank you so much.
You're very welcome.